Thank you. Good afternoon, everyone, and welcome to our ICTS seminar this afternoon. Today's topic is COVID-19 and the role of technology. The Potomac Institute has been studying terrorism for over 25 years at the intersection of science and technology. We're a think tank in the Washington, D.C. area, for those of you that don't know. So we're very happy to host Professor Alexander today, and all of the distinguished panelists that he's invited to join us. So thank you all for your time and your contributions in advance. A quick couple remarks about how we've seen the impacts of technology over the last 16 months. The first was when everybody went home to work, right? We sent everybody home. We would not have survived as a country without the internet. So I want to, the cybersecurity and the attacks that we've seen, the terrorist attacks to our cyber infrastructure, as well as blockchain and ransomware, have had a major impact on the country that we're seeing even more today than we did a year ago. The impact of sending everybody home on mental health and other health issues, right, put a toll on our medical community of how they were going to care for their patients. So hospitals closed down. They weren't able to have enough money to continue to do the work that they were doing. And everything switched to telemedicine and virtual visits, which we saw a lot of gaps in the healthcare here in the United States, at least, over time, right? So we understand this is not a domestic problem. This has happened internationally, and different countries handled it different ways. And technology spans each of those. And so you see contact tracing, what happened here in the United States versus other places, and the technology implemented to track that. As well as you see what happened internationally with different vaccines, right? So different countries presented different solutions for how they were handling their society and the medical capabilities in testing, ventilators, and vaccine development. So these are just a couple of topics that I'm sure, and there's plenty others that I haven't touched on today that I'm sure our panelists will talk about. But just a quick introduction of how drastic the technology innovations, right, and how lacking we were in some places affected us here in the country as well as worldwide. So with that, I will hand it over to Professor Alexander to continue the discussion today.
Thank you very much, Jen, for your welcome remarks to our forum today. And at this time, I wish to express again my appreciation for the Potomac support of our academic work, as you mentioned, for the past 25 years or so, and also deep appreciation to General Al Gray for his leadership over the years. Also, if I may briefly, we're grateful for the partnership with the International Law Institute. During several decades, our colleague, Professor Don Wallace, the chairman of the ILI, had unfortunately at the last minute change of schedule. He regrets that he cannot join us today, but as always, he will continue to contribute to our future events, the research and publications and so on. Also, certainly I would like to acknowledge the academic cooperation of our other partners on this particular forum that are listed on the program, namely the George Washington University, the Cybersecurity and Privacy Research Institute, as well as the Institute of Fusion Nuclear in honor of General Velarde in Madrid. And finally, I think we have to understand that the work that we're trying to do requires close international cooperation with numerous national and regional and global organizations in the United States, of course, and internationally. Before I introduce our very distinguished panel, I think we have to recall that King Solomon, a long time ago, always we try to mention him because very wisely observed that nothing is new under the sun. But of course, we still have to deal with Mother Nature challenges and man-made challenges and so on and so forth. And we always discuss the issue of the worst case scenarios. What's next? I recall for decades that we dealt with mass terrorism, which some called the new evil of this world. And I think the key questions, in my humble opinion, that we had to struggle with for decades is the worst yet to come, and will civilization survive? And if we look sadly at the daily statistics now of the COVID-19, globally, I think there were more than 181 million cases, and the death toll is probably around 4 million people died globally. In the United States, of course, we're watching it very closely, and there are some probably over 33 million people were infected, and over 600,000 people died. And again, the list goes on to other countries like Brazil and India, Mexico, and so on and so forth. So basically, the debate that is going on all the time is how to deal with the future challenges. And there are, of course, different views in the public discourse. What's the role, for example, of technology, which we're going to focus on today, or diplomacy, or the military response, or the law enforcement, so on and so forth. Now, just recently again, we find that President Biden, in his public statements and international meetings, he tried to underscore that in relation to the COVID-19, we must cooperate if we're going to defeat the COVID-19 everywhere around the world. So the question is, can we do that? Can we cooperate not only nationally, but internationally? And again, we have all kinds of alarm sounds. For example, from the CIA just recently about the COVID-19, saying that this continues to strain the governments, societies over the next coming years and fuel humanitarian and economic crisis and political unrest and so on and so forth. So basically what we're trying to do today is to focus on selected some of the technologies, including all the way from biodetection to questions of vaccinations, the cyber defense, and so on and so forth, and other health and security related concerns. Now, the approach is, of course, interdisciplinary, and our experts and speakers will share their academic and professional insights on these topics and offer recommendations, what we call the best practices and strategies in order to deal with disaster risk reduction. So it gives me great pleasure to introduce our friend and colleague for many years, distinguished University Professor Rita Caldwell. Rita and the other contributors to our discussion today, they really do not need a very long bio. They're very well known for their very exceptional contribution to our knowledge over the years. But if I may, I would like to mention that in addition to her academic contributions as university professor of Maryland and Johns Hopkins, she is also a senior fellow at the Potomac Institute for Policy Studies. And I recall her contributions going all the way back to 9/11 and so on. And if I may, I would like to mention her latest book. It is on the screen. I have it in front of me right here again. And obviously it is amazing how she was able to deal with different interdisciplinary issues, dealing with mathematics and engineering, and also the issue of women and minorities, and so on and so forth. But as a scientist, she was actually contributing to global infection diseases and water and health and so on and so forth. And currently she's developing international network to address the emerging diseases and what to do about them. So Rita, please make your presentation, the initial one, then we're going to continue with the other speakers and then develop a Q&A discussion. Rita?
Thank you very much, Yonah. It's always a pleasure to work with you and with the superb, distinguished team that you bring together for each of these forums. They are very, very illuminating and helpful. COVID-19 has upended all our lives. And interestingly, technology has provided both solace and solutions. I'm going to discuss very briefly, as an introduction to this important forum, a few of the many contributions of technology. And I expect you'll note that the foundational technology for each of the applications that I mentioned will trace back to many years earlier, usually 20 or more years, of basic research. And most, if not all, the technologies have derived from the research funded by the federal government, NSF, NIH, DOD, and the USDA, Department of Energy, and many others. So if I may have the first, or the next slide, if you will. This was taken today. It's the most up-to-date dashboard. Now, this kind of big data analytical presentation has made it possible for us to monitor on an hourly basis, on a minute basis, minute by minute basis, if necessary. As you can see, on the right are the numbers of vaccinations. In the center are the number of cases, and to the left, last updated at 10 o'clock this morning, we can see that indeed, as Yonah has mentioned, 604,152 lives have been lost to COVID-19 just in the US. And other countries have similarly suffered enormous numbers. And now we know that from this constant tracking, which we can do in the 21st century, which we could not do 100 years ago for the earlier pandemic, shows that technology keeps us informed, perhaps more than we want to be, informed, but nevertheless, it's critical, this kind of communication and data analysis that is possible with COVID-19. The next slide. And then there's the technology of temperature scanning. We could barely go into a supermarket or to an office without having our temperature scanned by devices that will provide an instant determination of the presence of a fever or a fever condition. Unfortunately, we've also been able to use technology to provide remote learning and communication, but for children, this is a mixed blessing. For some, remote learning has been, for those who are introverted, has been an advantage. For others, it's been a disadvantage. Nevertheless, by virtue of being able to connect, we have been able to provide mechanisms for ensuring that children will continue to be educated. It has its limitations, and I think we'll be discussing that today. The next slide, if I may have the next slide, even going into restaurants, the QR codes have eliminated menus. In fact, I recently attended a restaurant where it was actually imprinted on the table itself, the menu, and with your cell phone, you simply scanned the table surface and that gave you the menu, and you could place your order without even the necessity of a waiter or waitress. And then robotics have been really critical with the difficulties in obtaining personal protective equipment, masking, availability, and so forth. Having robotics to provide the interaction between the medical personnel and patients. And interestingly, that lower photograph is of robots in Rwanda in Africa. So it is now the technology transfer globally that has allowed us to fight, if we can collaborate successfully against the COVID-19. Now the next slide, please. But the biggest, of course, technological development was both the capability to utilize what had been developed over 20 years of intensive research. The RNA, the ribonucleic acid vaccine directed against COVID-19, coupled with the massive investment, but the availability of the capacity to produce huge amounts needed of the vaccine to achieve hopefully 70% or the herd level of immunity. It's important to understand, as shown here on the slide, that the messenger RNA vaccine is different from the DNA of the cell. The DNA is a double-stranded molecule, whereas the RNA is a single-stranded molecule, and it converts the genetic code information in DNA to production of proteins. We have the next slide. And what also is important to understand is that the flow of genetic information to protein formation, in this case, the example that I'm choosing, the production of antibody, the DNA replication is the process where identical copies of DNA are made, but transcription, the translation of the information in DNA, then is converted to the machinery of the cell via the single-stranded RNA for the production of the protein, namely the antibody. You have the next slide, please. The virus structure is fascinating because it is a single-stranded RNA that is surrounded by an envelope, a lipoprotein envelope. And the envelope has little spikes in it that we've all been reading about, which are really just extrusions of protein. And then the spike protein is fortunately an effective target. And by being able to produce a response, a genetic response, namely the production of a protein, the antibody, it then can envelop the virus and inactivate it. We have the next slide, please. And so this very simplified view of a very complicated but successfully technologically developed vaccine approach is the orange coding region is the genetically engineered sequence of the modified messenger RNA that codes specifically for the prefusion stabilized spike protein. That is, it codes for the production of the spike protein, which then induces significant amount of antibody protecting the individual. May I have the next slide, please? And of course, the vaccine delivery is not novel. We've been doing this kind of vaccine delivery for nearly 100 years now. But it has proven to be highly effective. And the fact that we were able to utilize, which I don't have time to go into, the production engines of industry to achieve large amounts of vaccine to be able to deliver millions, well, billions actually, of doses. We have the next slide, please. And my final brief technology comment is that because of the necessity to distance, to wear masks, to wash hands, to avoid contact, telemedicine has taken off, because now we have found that we can do a great deal of medical treatment, diagnosis through the computer, through a mechanism, a Zoom, if you will, or many other video teleconferencing capabilities, to very effectively then provide healthcare delivery in a way that apparently will continue. In other words, what we have seen with COVID-19 is technologies that were either early stage or perhaps just being considered have been put to use. I do think, however, the most important message is that fundamental research precedes the technology. And in order to be able to address future pandemics, future disasters, we really must invest significantly in fundamental research. And I read on my iPhone just an hour ago that fortunately the investment bill, the research investment bill, has been approved by the House, and I hope that it will follow approval in the Senate, because that investment in fundamental research is very significant and desperately needed to maintain the strength of the United States, our country, and certainly fundamental research is necessary for technological developments in the future. So with this very brief overview, I will turn over the podium to my colleagues. And I hope that it will be clear, and I'm sure to my colleagues it is clear, that technology builds on basic research, and technology is the mechanism, provides the mechanisms with which we can address and meet future exigencies. So I thank you for your attention, and we'll be happy to take any questions during the discussion period. Thank you.
Thank you very much, Rita, for your sober insights related to bio threats and your message related to the role of research. And obviously, your presentation, as always, triggers many questions. And as you mentioned, you will have an opportunity to respond to some of the questions during that session later on. Again, in the interest of time, I would like to move on to our next speaker according to our program, and is Dr. Donald Gerstein, a former acting Undersecretary and Deputy Undersecretary for the Department of Homeland Security. Again, I will mention a few highlights about him. He contributed a great deal to national security concerns as a civilian in uniform and industry. Academically, we had the honor to host him several years ago when his very important publication, the book right here, or you have it on the screen, in terms of the story of technology, how we got here and what the future holds. He sent, of course, some important messages to deal with the issue, the role of technology in terms of our challenges, not only the bio, but the broader, I think, security challenges. And he himself participated in government, as I mentioned, in the Homeland Security, but also the Pentagon, working for the Secretary of Defense at that time, dealing with weapons of mass destruction, for example, and so on, and in the military also throughout the world. So welcome, Dan, and please proceed with your presentation.
Well, thanks very much, Jan, and it's great to be with this very distinguished group. I do have to say it's interesting to follow Rita, because I could almost say thank you very much for your attention. That concludes my briefing. My top line message is very much what Rita's is, and that is that you'll see it on the slide, but the basic research of today is really the technology of tomorrow. And if we don't take care of that and watch it very closely, then we could be in trouble. I have a couple thoughts that I'd like to share with you today. The first is that, we've learned many technology lessons over the last 18 months. And I would say that some are good, some are not so good. It seems like just about everyone out there now is a amateur epidemiologist and virologist. And I'm just kind of wondering which of the lessons are actually going to stick. I think there are some really important ones that we could take away. I'm going to focus all of my attention today on biotechnology. I know that others are going to be talking more on the computer side and such, but I want to really talk about the biotech. And I am recovering DOD, which means I have a lot of slides. They're too busy, there are too many words, but don't be intimidated, because what I really want to do is talk concepts, and I don't want to talk any of the real details. in any case, what I want to do is talk a little bit about the mRNA vaccine, but I want to do it from a different perspective than Rita did. I also then want to jump into concluding thoughts and then some implications. So next chart, please. And here is an eye chart, but it's very easy to get through. Lots of words, but mostly concepts. What I was trying to do was to look across the different pieces of a response or a preparation for a pandemic. And it begins, of course, with the biosurveillance and intelligence and the preparedness and the prevention, with the clinical operations and the detection, and then the response and recovery. And down below, I have put in some cross-cutting technologies. And I recognize that you'll look at this and you'll say, well, I don't agree with Dan about this. Why did he put, for example, immunotherapies only under clinical operations? Couldn't that have been on recovery? Well, absolutely. And that's part of this, is that, as you'll see, this convergence of technologies that we're experiencing means that there is a tremendous amount of interconnectedness. But let me just give you a couple examples of things that I think are really interesting lessons. So the first one, under biosurveillance and intelligence, on environmental sampling. We've been talking about One Health now for well over a decade. And it rings true that we would do very well to continue to think about One Health, but to put more skin in the game, if you will. Many are now talking about nanosensors, which is the number 2 under biosurveillance and intelligence, including the idea of biosensors and nanotechnologies that are wearable, that can be a early warning system for us. Look at the third one down on the novel sensing and wastewater. Now jump over to the preparedness and prevention. Gain of function research has gotten a lot of press recently, but I do have to say, having run several laboratories that were involved in what could be considered gain of function research, it's a very misunderstood set of technologies. And it's something we need to think about before just cutting off any sort of further research. Years ago, I talked to the head of BARDA about this, and he told me that the gain of function research done as part of the dual use research of concern issue back in 2012 actually changed the way they developed the seasonal influenza, and it paid dividends there. Look at down at the bottom of that prepare and prevent under strategic national stockpile. That's an issue that has been problematic, and we learned a lot of lessons, and we need to figure out what needs to go in the stockpile and how to augment the stockpile with supply chains that are more effective. In the clinical operations and detection, obviously diagnostics has to be first and foremost. But I've also jumped down into personalized, personalized medicine. We've learned a lot just through the COVID about how different people are reacting to different therapies and protocols that they are exposed to. And then, of course, on the response and recovery, the rapid vaccine design, the bioforensics, and across all of these is really modeling and simulation at the cellular level, at the host level, at the organizational level. And we don't have those capacities today. So I think I'll stop on this chart and I'll go to the next chart if I could. So what you should be seeing are those blocks in yellow. And what I'm trying to get across is that if you look at the pre-genomic age, those types of technologies were the ones that were in very early stages. And there was a lot of early work that went on. And we talked about questions of the theory of immunology and germ theory. People like Koch and Pasteur were involved in thinking about those issues. And there were theories of vaccine development and laboratories, even if they were much more rudimentary by our standards. And of course, thinking about genomics, manufacturing, and distribution. Now, what you see is underneath of those, the blue blocks. And in particular, if you think about, let's move over on the theory of immunology and we think about disease and what we learned and how we applied those concepts, those are the same building blocks that we use today. They are all derivative. And as we walk down into the vaccines, you see them listed, vaccine types 1 through 5, and at the bottom is messenger RNA. They all function with the same basic concept at the top end. That is to develop an immune response so that the human or the host's immune response will be able to recognize and defend against. And you look at the laboratories, including what we learned, you know, people somewhat take for granted, but much of what we learned about high containment comes about from our work with very deadly pathogens during the height of the US offensive program. And many of those same concepts have been translated down and are working to be able to solve today's problems. Think about genomics, all that we've learned, starting with the discovery of DNA back in the 1800s, but then the DNA, the discovery of the double helix back in the 1950s, and all that's come off of that. None of what we're seeing today with the mRNA vaccine would be at all possible without that basic research and the concepts that came forward. And notice things like Human Genome Project and CRISPR-Cas9 and DARPA's program that began in 2010, which was instrumental in messenger RNA technology and also the lipid technology that would prove so absolutely important. And then look at manufacturing and distribution. You know, we always kind of forget that we've been doing distribution of medical countermeasures before. One only need look at the smallpox outbreak in New York City in 1947 to understand that we were able to inoculate over 6.35 million people in a little over, a month or so. And that was very important to stopping that outbreak. If you go to the next chart, please. So how did we do this? And we're not going to go over any of the words, but look at the yellow blocks. We started with funding and investments, with taking the science that we had. BioNTech was funded. They were allied with Pfizer. And I'm concentrating now on the Pfizer vaccine, but it's, you know, I didn't want to go over all of it there, but there are a lot of great lessons here to be learned. And it's interesting how Pfizer's CEO thought about US government funding in this and how he didn't want to be tied to that. Now go down into the vaccine and medical countermeasure development and think about, you know, the sequence, the target sequence, actually 4 target sequences were actually identified within a handful of days. They thought that they had some workable capabilities that they could build into a messenger RNA. They understood the sequences. And then the series of trials. And, you know, we took a process that had actually taken, you know, over a decade to do. And somehow we were able to put it into this very compressed time frame. We'll talk more about that. Next chart. And then as we think about manufacturing and distribution, and again, we learned about technology. And you think about, you know, I talked a little bit about this idea of the production of, you know, what we did with lipids and nanotechnology to be able to develop nanoparticles that could actually be stabilized and put into a vaccine where they could then have their desired effect. You know, Operation Warp Speed was, I would say it was a success, but it also had elements that were not so successful. So it was successful in helping to stimulate this process, but on the other hand, you know, there were some pretty significant issues with what I think the Biden administration did master, which was the last tactical mile, getting vaccines into arms. 300 million vaccines in 150 days, and the hopeful development of over 3 billion vaccines in 2021. And, you know, some issues surface. You know, we think about intellectual property rights, we think about cross-contamination of the Johnson & Johnson vaccines and vaccine nationalism. And I go over this to say it's actually not that easy to develop and to distribute vaccines. Next chart. The only thing I'll say about this is regulations and ethics. And the question is, you know, that top one about the process normally taking a decade or more and now compressed into 9 months, that's a little bit misleading because I just showed you on a previous chart that it was literally decades worth of work that went into developing an mRNA vaccine, basic and applied research and development. But, you know, the question is, what can we actually learn now? And what can we do to shorten our timelines? Next chart, please. So, you know, this gets right to Rita's point. And, you know, on the top line, some concluding thoughts. You know, the technology of today was the basic research of yesterday. And, you know, if you think about the United States today, we're only spending about 2.6% of GDP on research and development. I asked the question, is that enough? Is 2 times that enough? Should it be 6%? Should it be 8%? What should it be? And we really have to ask ourselves where we would be if we had not done the research and development we have done, but if we had even gone faster on some of it. You know, the other thing that we have to deal with is that second conclusion about trying to develop the 21st century technology, but we're using some pretty antiquated, if you will, processes and laws and concepts. And here, you know, I like to point out that our emergency management doctrine is actually emanating from 1804 and the Johnstown flood. So, you know, it's well worn. And the question is, does it suit us for this day and age? And think about the FDA processes for the medical countermeasures approval. But having said that, we just have, you know, the Alzheimer's drug that, you know, is now getting criticized for not using proper procedures. So there is this tenuous balance. On the third conclusion, I really think we're challenged to identify and assess and mitigate risks. We have shown ourselves here in this country more generally, just to say, we have not done well to understand and really mitigate the risks. And a lot of it comes down to strategic communications and how we communicate risks. But that is something that we really need to understand because it cuts to the bone of our overall response. My fourth conclusion is that policy without science is fantasy, but science without policy is problematic as well. And I go back on this to say, look, you know, things like hydrochloroquine and bleach and all, those really took the eye off the ball. But, you know, we also had a problem in the Biden administration, early stages, about the CDC's communication of risk and masks and who can unmask and what level of protection. And so somehow there has to be a melding between policy and science, where it's a science-informed political approach to interfacing. And I don't mean political in a, you know, a highly charged way, but I mean, you know, there is a policy element to the guidance, that the scientifically informed guidance that is coming out. And my final conclusion on this slide is the innovation, and we need to figure out what we saw in terms of innovation and what now can survive. And let me very quickly go to the last chart. So 3 things. The first is, again, Rita brought it out wonderfully, but it's about the public-private collaboration. It's figuring out funding for research and development, and how do we cross the valley of death with all these great ideas that are out there. You know, we have a tremendously innovative country, but we don't always necessarily bring things full circle and move them forward. You know, when we look at the opportunities for innovation, we should be questioning our methods and understandings. And I would hope that organizations such as Food and Drug Administration would be looking to say, what were we doing in that 10-year vaccination approval process that could be moved and Lean Six Sigma to pull out the wasteful and make it streamlined so we can get vaccines, therapeutics, those kinds of things out more quickly. And then, finally, I think this one is more encompassing, but it says really at the bottom, the last sentence, rethinking of our national research and development enterprise. The enterprise of today is essentially the same as it was or conceived of at the end of the Cold War or at the start of the Cold War in the late 1950s. And we have been living off of that. It has served us well. It has some great components. But I ask the question, is it up to the challenges and opportunities of today? And I thank you for your attention. I look forward to a good dialogue.
Thank you. Thank you very much, Don, for your overview. And following Rita Caldwell, I think between the two of you, we do have not only a mini course, but a yearly course, and we're going to integrate, of course, your insights and observations into our reports that we're planning to publish with your approval, and then to bring it to the attention of the wider public. Now, if I may, we would like to move on with our next speaker. I would like to briefly introduce Professor Donald Milton, who is Professor of Environmental Health at the University of Maryland, the School of Public Health. He has also secondary appointment at the Department of Medicine, the School of Medicine. And again, we do have basically the insights of someone who focused on the interrelated areas of infection, for example, and bioaerosols, as well as dealing with development and application of innovative methods for different areas. And he, for a long time, also was a principal investigator on issues related to how people submit the COVID-19 and how to prevent it from spreading. So I think here in terms of expertise, wide range of areas, that's a few I mentioned additionally, like influenza and biodefense and bioterrorism and environmental occupation issues, diseases, and so on and so forth. So we welcome his insights at this particular time. Professor Milton?
So, well, I want to thank you all for inviting me today, and for Dr. Caldwell, especially for extending the invitation. It's a pleasure to meet you virtually and get a chance to share some of my thinking about technology and how it can, technology and new research can contribute to helping us control future pandemics. I'm very much concerned about the causes of our early failure. We are now seeing some late big successes with the biotechnology that has come into play now to respond. And it looks like in the future, we will be able to respond more quickly with that technology, and get the time lag between when a pathogen is first identified and we have pharmaceutical interventions reduce dramatically, but there will always be some lag. And the question I raise is, how well can we control a virus during that lag? And if it turns out to be a more difficult one to control, we're fortunate that SARS-CoV-2 evolves relatively slowly compared to HIV and is not as mutable in terms of its antigen presentation, so that we can make vaccines against it. We could get lucky. We could have something that's basically like measles, which is constrained and can't evolve. So once you're immunized, you're done. But pathogens that evolve and evade immunity and are going to present problems. And if we get one that evolves more rapidly, it's going to be a really big problem. So how do we control pandemics in that early phase, which hopefully is not prolonged? And in this pandemic, we had a perfect storm. We have an airborne transmissible agent that it was known early that this was probably airborne. Trump claims she warned him, as Bob Woodward has told us. China sent medical personnel into Wuhan in full PPE with respirators and claimed none were infected. WHO retracted early statements and called airborne warnings false, even posting a false label on top of some things on Twitter. Why did we have this lack of clinical and public health understanding and ability to respond? This lack of understanding resulted in a delayed recognition by WHO and CDC for 15 months. It meant that airborne infection controls were not implemented in most countries. And I would say that I think that that is one of the major reasons that we've seen it spread, that it's become this global public health and economic disaster. Now, there were people who are concerned, and I claim to be one of them, having here some of my early tweets on the subject from last year, pointing to a paper we had published a couple of years before, showing that influenza is infectious in the breath with up to millions of RNA copies present in the breath. Lindsay Marr was an early person raising questions because we had been working in this area of understanding aerosols and infectious aerosols in particular. But outside of a small community of people doing this research, there wasn't really much known about it. Within medicine, pulmonologists who deal with TB transmission know about airborne transmission, but they think of TB as the only truly airborne transmittable infection, and so they did kind of poo-poo everything else as not as important. An infectious disease community generally downplays it. Why? Because they don't get any training in it. They deal with sexually transmitted diseases, waterborne diseases, vector-borne diseases. They don't deal with airborne transmission. And so they don't get trained in it, and they don't know anything about it really. And that became a huge vulnerability globally. We really need to be able to control transmission early when vaccines and antivirals are not available. We need to stop airborne viral spread before it causes a global pandemic. And we need to be able to do that without shutting down the economy. So we need to make our economy robust and resistant to transmission. And we need to have that happening in a passive way through the technology we implement in our buildings so that we don't need to be thinking about this and depending on behavioral changes to protect us. So we could talk about modes of transmission of respiratory viruses, and you may have heard the clinical paradigm of contact, droplet, and airborne. Many of us are pushing to move away from that now, including many prominent members of the infection control community, including Michael Klompus, who's a direct infection control expert at Harvard and Brigham and Women's, and really begin to think about how do we transfer? What's the transfer process? Well, you can get sprayed with ballistic droplets. You can inhale small particles floating in the air, and you can touch a contaminated surface and then touch your own mucosa, rub your eyes. These are the three main mechanisms by which respiratory viruses transmit between people. So we know this, but we tend to downplay inhalation, partly because the medical community mistaking respirable aerosols, which are less than 5 microns, which make it deep into the lung. And that's the only thing that's really important with TB, because TB can't infect the cells in your nose. But when you talk about measles or influenza virus or SARS-CoV-2, those viruses can infect you in the upper airways. So a lot of different particle sizes matter. And that has been lost on the medical profession until very recently. Of course, now, and many of you have seen these pictures, we have abundant evidence from multiple outbreaks, which were characteristically in environments where there was very little transmission at the time. And that's how it was recognized what was happening. Once it becomes highly prevalent, it's very hard to know where somebody got infected if it's by airborne, because it could have been, as we've been seeing in Australia recently, even a fleeting interaction. So this outbreak in a restaurant in China that was outside of Hubei province, where this one person had recently traveled from Wuhan and had dinner with her family and friends and infected people at other tables. The infamous choir practice in Skagit County. And I must say, this group of the choir director and the group really need to be commended for sharing their experience with everybody, because every choir was singing it back at that time. And they really deserve our thanks for being willing to have their case publicized and warn everybody else. Then a few months ago, and this is before the Delta variant got to Australia, there was a singer in the choir loft at the piano facing this direction who infected all these people down below, more than 10 feet down on the floor of the auditorium. And a restaurant outbreak in South Korea, where the index case and his partner came in the back door, and these people came in the front door and went out the front door. They never got closer than where they were seated in the restaurant. So this evidence, and then this culturing of the virus from air samplers in the bedroom of COVID cases in Florida, in a Florida hospital, really have told us that aerosols are important in this infection. So when we look at what's been effective in schools, we see this paper from Hopkins recently that teacher masking was really important in reducing transmission in the households of children going to the schools. Symptom screening was important. Not having extracurricular activities where people got closer together was important. Having outdoor instruction may have been helpful too, But there was one thing that was clearly bad, and that was plexiglass partitions on desks. And those of us in the aerosol community look at this and said, of course, when you have some people sitting in a classroom and exhale plume coming up from the people, it's going to dissipate quickly when you have good ventilation. But when you put in partitions, you block the ventilation. And so now you get buildup of concentrated aerosols. And of course, anybody walking past that partition to go to the bathroom is going to get a nose full of virus. So what are the technological things we can do about this that could be happening all the time so that we are protected? One of them is ventilation, and you've heard a lot about increasing ventilation, but there are things that are much better than ventilation, and they have to do with air sanitation. Now, years ago, actually in a biodefense grant in the early 2000s, we used vaccinia virus that we got from Mancambus across the river in Cambridge from Boston, where I was working at the time, sprayed it into the air of a simulated hospital room and showed that, whereas in a hospital room, you may have 6 air changes an hour, and in an isolation room, 12, even with just 1 unit under high humidity conditions with 2 air changes an hour, we were getting 20 air changes an hour on top of the ventilation in the room by having upper room UV. And under the best conditions, when we had 4 UV units and 6 air changes an hour, we added an extra 1,000 air changes per hour of effective air sanitation. You can't do that outside of a hurricane. And you can put these things in classrooms, as we did in Groton, Connecticut, in a study we did about 20 years ago. And technology's been around for a long time. It's not new, but there hasn't been much application of it. One of the reasons we don't apply these things and use this knowledge is that we haven't filled the gap with the research. The clinical community is asking for gold standard randomized controlled trials. The WHO infection control experts keep asking for it, saying, well, there's been no RCT, so we don't believe that it's airborne. Well, there's only been 1 randomized controlled trial ever done of the mode of transmission of influenza. That was, we published in 2020. There were a couple done with rhinovirus, but in those, they didn't measure ventilation. One of the things we did in this study, which these are a few little pictures from that and diagrams from that study, we very carefully simulated the ventilation in those rooms, measured it, and determined what the effective ventilation would be. And what we got was, by having a moderate amount of ventilation, it was nearly impossible to transmit flu. We need more studies like that go into greater depth, that include advanced technologies for bioaerosol detection, advanced detection of infectiousness of those bioaerosols, and then very highly controlled studies to test air sanitation interventions to see if they make a big difference. NIAID recognized this even before the pandemic with the release of this RFA in June of 2019, which they committed $6 million a year to fund 3 awards over 5 years. And I've been told we will be awarded one of those, and that they may not award any others because we got the best priority score by a big margin. But the reviewers still wanted a bigger study, and they wanted a longer study. And we really need the proper facilities to do these studies, and they don't exist, where you can simulate low ventilation and high aerosol exposures, test new controls, and especially things like 222 nanometer UV, which I think it holds tremendous promise for the future. And we need to be able to monitor exposure by all routes. Now we're beginning to recognize the airborne spread of COVID-19 is really important, and that the failure arises because of lack of clinical knowledge, and there's few experts trained in the field. So we really need research on what to do during this critical period before vaccines arrive. And this picture here, unfortunately, is a little fuzzy, is from a restaurant that has 222 nanometer UV installed. You can't even tell that it's there, but they're using excimer lamps, and you can flood the entire space with it because it's safe. It doesn't penetrate the skin or the eye. And yet you're sanitizing all of the air all the time, even in the near zone between people. So we need infrastructure. We need to incorporate new knowledge and new technologies into the infrastructure that we build and replace. We need it to be resistant and robust to transmission of airborne infections. And we need to prevent transmission passively before hazards are known and without requiring people to do stuff that they may not want to do, like wear masks, and much less shut down schools and businesses. Thank you.
Thank you very much for your very comprehensive, I think, insights here, particularly learning the lessons of failure and trying to provide some guidance, multidisciplinary research before vaccines arrive and so on. We obviously will integrate also your research conclusions and the pathway for success in the future. So I would like to move on in the interest of time to invite our two colleagues who will provide, I think, a team work on this issue. Dr. Kostis Torges, who is Director of the Cybersecurity and Privacy Research Institute at the George Washington University, and his colleague, Dr. Neil Wasserman, Department of Computer Science at the George Washington University. And both of them prepared a PowerPoint that I think would be extremely useful in terms of the research on the cyber security and some related health and security issues in general. So I would like to invite both of them to share their insights and conclusions about their work in this important area of public concern.
Thanks very much, Professor Alexander. And we're delighted to join this very important and very learned group and add our own experience in the topic of technology. I have to admit that the presentations that have preceded us have been breathtaking. Ms. Caldwell, your reputation at the National Science Foundation and elsewhere shows why you command such respect. You're right. Basic research is vital, but it's more important perhaps to make sure that the communications link of what the basic research can do is made to the decision makers. And Mr. Gerstein, or Dr. Gerstein, you mentioned the science policy interface. That is hugely important and I think misunderstood, or perhaps not understood enough. How we communicate the benefits of science and more specifically the benefits of technology to decision makers, whoever they may be, whether they're budgeteers, in Congress or whether they're private sector or whether they're individual citizens like you and me. So what I'd like to do is to take a step up and tell you a little bit about what we're trying to do at the George Washington University to create some scientific discourse, some communication, and some connections between two disparate branches, both of which don't know each other exists almost. And perhaps out of that, we can draw some conclusions and discussions. If I can have the first slide. The mission of my own institute, the Cybersecurity and Privacy Research Institute, is to provide faculty and students at the George Washington University with a platform for interdisciplinary dialogue on cybersecurity and privacy issues. And of course, the three words that most people that have gone through a university will know quite well is research, education, and service. So what we're going to discuss now falls into this latter category of service. If I can have the next slide. I've had a long experience with international groups, the Nations Disaster Risk Reduction Program, for example, in Geneva. I've been an expert on their group that looks at global risk assessment frameworks. And it dawned on me that there's so many people so wonderfully engaged and involved in disaster risk reduction, this DRR, who didn't really know much about technology. They use it every day on their phone, but didn't necessarily understand its impact and how to introduce it. So when we began to look around with my friend Neil, that you'll hear from after me, for a topic that would bring these two disciplines together, technology and disaster risk reduction, we felt that it was important to get scientists or decision makers in those two fields to agree to work together and to collaborate and to do perhaps the simplest thing of all, which is write a paper together. We joined with Neil and a colleague in France to develop a call, which is open until January 2022, actually, for papers in the intersect of blockchain, which is a cryptographic technique, and you'll hear more about it from Neil, and disaster risk reduction. If I can have the next slide. And I'm almost done. The next thing we thought we would do is to begin to develop a community of interest. And you can't read the slides, they're intended just as visual mnemonics to me, but we started doing webinars every month. Every month we had a webinar, and the number of people began to grow, and the geography of the people who would show up began to grow. We called it our Disaster Risk Reduction and Blockchain webinar. And pretty soon we had people like an ambassador of Israel to Colombia. We had the head of the United Nations Development Program in Central and Western Asia show up. We had people from Ernst & Young and other consulting firms show up. We had a tremendous number of people, including faculty and students from GW and other universities. So this creation of a place to meet, a place to hear each other's vocabulary is so important, because nobody owns a scientific problem anymore. It's all done through groupings, through connections, through a network of smart people, scientists, but not only scientists, but also policymakers, budgeteers, and communicators. So how to get these people together is a challenge, and is work to be done as well as the scientific work itself. Good scientific work by itself will not suffice, in my mind. If I can have my last slide, I think it's my last slide. So we are beginning to engage in a community of practice, a COP, as Mr. Wenger called it some years back when he wrote his book on communities of practice. We're looking for students, faculty, entrepreneurs, industry, government, the NGO community, and global partners. It takes time to develop this community of practice. This is what, Professor Alexander, you're doing. You're building a community of practice. Our own vision is a community of practice has to be broadly based, and it has to begin to include those for which we are working so hard. The actual people on the street, the actual non-governmental organizations that work on the problems, that we work on the problems on their behalf. So therefore, building relationships between disciplines of science and disciplines of application in our society, it will not be done by itself. It has to be done carefully, and it has to be done by people who know how to build communities of practice. So in addition to the importance of basic research funding, I would put somewhere there, let's make sure that we fund the connectors, the bridge makers, the people who understand each other's language. Because without that communication pattern, our disasters will continue to grow and our ability to fight them will continue to diminish. So with that cheerful note, I will give it over to my friend Neil.
Good morning, everyone. Next slide, please, or you can skip my name slide. Next one, please. Anyway, let me just say that I've learned a great deal from the previous speakers. The thought occurred to me that those who advocate bleach might be mandated to take their own medicine. That was one lesson learned, and the world might be a better place. But on a more serious note, Donald Milton's presentation raised the possibility of connecting him with my colleague at GW, who does experimental research on dispersion of aerosols given a complex airflow environment. So I'm going to link the two of you, and maybe something productive will happen out of that. But more, on that theme, the connection between the policymakers and the technologists is kind of what Kostis and I have been trying to make happen. And we feel an urgency to this project, namely because the onset of disasters in the disaster risk reduction framework seems to be accelerating due to climate change, due to the onset of pandemics. And it's a very happy coincidence that the technologies that have emerged around CRISPR and mRNA have converged at the time of this pandemic. And we need to learn to derive benefit not just from the lucky coincidence, but from what we know about the need to manage behaviors that are that mitigate disasters, and also create the kind of networks that will manage these impending events, which we know will happen. We just don't know what event will happen, where, and when. Next slide, please. So one of the opportunities that we've identified is to connect blockchain, which I'm not sure how many people know what blockchain is, but let me just describe it in one brief sentence, that it's a type of linked data structure that records transactions, sometimes cryptocurrency related. It's distributed over thousands of servers. That is the data structure, with a consensus mechanism that is some way to agree on things to determine the validity of blocks that can be added to the chain. And that's basically the core of the concept. And what we're looking at are opportunities to apply this technology to the disaster risk reduction universe. And there are various blockchain applications of asset registration and identity and data access and permissioning to facilitate interoperability. And in the disaster management universe, we often need to connect disparate data sources, just as COVID accesses data from many, many sources, and the integration of those data sources tells us something about what we need to know to manage the condition. In terms of disaster risk reduction management, this can be applied to predictive modeling, to carbon accounting, to certification of infrastructures, allocation of resources, managing supply chains, many applications. And in the new way of thinking about disaster risk reduction, we take a broader larger timescale view of things. Next slide, please. So this is what blockchain can do for DRR, connect behavior with incentives, and we know behavior is at the core of disaster management, as COVID has demonstrated. And maybe I'd like to use the term toxic entropy exposure. That is the onslaught of the noise of information. In order to manage any complex environment, we need to control this information, and blockchain is kind of an entropy reducer because it makes decisions around data sources. And the other goal is to create what I like to refer to as synchronization of behaviors. That is, across populations, we need populations to behave in a way that is conducive to limiting risk. Next slide, please. So there are a lot of challenges in achieving these goals. Among them, I think the most significant are the cognitive obstacles to recognizing threats. And I think that's just a very interesting question. You know, what are the factors that enable human beings to recognize a threat? So terrorism, for example, is a threat because we can kind of know the target, but pandemics are probably a much more important threat, at least in terms of numbers of deaths associated. And it took us much longer to identify the pandemic as a threat because of the, well, I'll just leave that question on the table. You know, why is that? We need a means for global coordination. You know, who is the first mover on these issues? And we're facing a compressed timeline for action. That is, in climate change, we view the next decade or two as being critical. Are we going to face that with the urgency that's required? And then, as Kostas mentioned, there are different frames of reference for policymakers and technologists. We can't exist in our own universe. We have to find mechanisms to communicate and collaborate. And that's what Kostas and I are trying to do in our limited domain. The last slide, please. So I don't want to leave you with just challenges, because I'm actually optimistic that we can deal with some of these issues in an effective way. One of the reasons being a growing public awareness of climate. On the West Coast, I'm sure people are very much aware of climate change, facing 115 degrees in Portland and other places. There's been an acceleration of technology solutions in bioengineering and blockchain and artificial intelligence, a maturing of these technologies. There's an increasing prospect of international collaboration, which we know is necessary. We can't fight or control the pandemic without a global perspective. I applaud Biden's contribution of 500 million vaccine doses, but that's kind of a drop in the bucket in terms of what the global requirement is. So we need to amplify that target. And there's an increasing acceptance of time advance action for disaster mitigation. That is, we have to prepare now for disasters that would occur in the future. And so with that, I'll just leave these questions of, you know, how do we recognize threats? How do we respond to threats? How do we collaborate among disparate or distinct cognitive communities of interest? You know, how do we connect those modes of those vocabularies? And I'm sure everyone will have some very interesting things to say on these and other subjects.
Thank you very much, both of you, for your contribution and reporting on your research in terms of the threats and the response opportunities. We'll come back to you, obviously, with some questions later on, but again, the clock is ticking, and we would like to move on to our next speaker, Dr. Eric Moore, who is director of the U.S. Army Combat Capabilities Development Command and the Chemical Biological Center. And I think here we have an opportunity to have a cross of different disciplines and responsibilities in terms of the defense of chemical, biological programs, medical countermeasures, for example, and so on. And Dr. Moore oversees many of the nation's key chemical and biological defense research and engineering projects. And in this role, obviously, he works not only with government agencies, but also with industry, the academic community, and so on, in order to deal to enhance the warfighting readiness and response to chemical, biological threats. And again, as I mentioned before, his role at the U.S. Department of Defense Science Technology work for a long time. And also, I think we have to mention his experience in the military. Again, the Armed Forces Medical Intelligence Center and Defense Intelligence Agency, and so on and so forth. So we have a broader, I think, perspective, not only the lessons that we learn on the biological threats and responses issues, but also on the chemical and the broader issues of nuclear, I think, challenges that we have to keep in mind at all times. So I would like to invite Dr. Moore to share with us some of his research and activities and building a bridge between the civilian and the military and internationally.
Thank you. I really want to take the opportunity to say I'm elated to be amongst this distinguished panel and this distinguished group today. One of the things that I think the COVID pandemic taught us is that in some areas, we used to be better poised to protect the nation. In other areas, some areas have atrophied. We came together in some very interesting ways, which I think were good overall, but we had some really good lessons learned. And I want to kind of highlight some of that and also highlight how we integrate not only within the Department of the Army, Department of Defense, but also with some of our academic, industry, interagency, and also some of our international partners. So next slide, please. We can start with this one, but I'll ask you I want to catch us up a little bit so we can move past some of them, but right here. So the Edgewood, what's now called DEVCOM Chemical Biological Center, our command changed. Army has a new 4-star command, the first time since 1974, which likely won't happen again in most of our lifetimes again, that another 4-star command will be established. And it's specifically looking at modernization of our forces and achieving overmatch. We're located in Edgewood, Maryland. We used to be called the Edgewood Chemical Biological Center. And we have facilities in Pine Bluff, Arkansas, Rock Island, Illinois, as well as Dugway Proving Ground, Utah. And so when Dr. Milton was talking about a number of the bioaerosol capabilities, I resonated with that, both from my previous job when I was at the Defense Threat Reduction Agency, where I funded a lot of bioaerosol research efforts, to now where I actually have 2 major laboratories. I have a laboratory that does bioaerosols here at Edgewood and one that does it also at Dugway Proving Ground, Utah. They're also involved in a lot of the testing and evaluation work that goes on. So the mission, as highlighted, is to provide innovative chemical biological. So we really work throughout the CBRNE spectrum, although we initially started 100 years ago, well, a little bit over that now, 1917, as a chemical munitions filling station to ship chemical munitions across the Chesapeake Bay and the Atlantic over to the European theater during World War I. And in that regard, as we look at some of our defensive capabilities that allows the joint warfighters dominance on the battlefield, but we also do probably about 50% of our work supports interagency defense of the homeland. So those two are very linked together. A lot of that work goes on with support that we do for Department of Homeland Security, as well as the National Guard Bureau, and working with some of the civil support teams that function there. So this capability area spans everything from S&T, research and development, design, test and evaluation support, and really just providing some of the nation's premier experts across several technical domains: protection, detection capabilities, decontamination, operations, and also obscuration. The workforce that we have is a very skilled group of scientists, technicians, and engineers who work together to combat some of the world's most dangerous cyber threats. And during the COVID pandemic, we worked with a number of partners to support pandemic responses and relief efforts from, hold on one second. So from throughout the nation and the government. So initially when this occurred, there were a number of small businesses that contacted us. Everyone had face mask capabilities, respirator capabilities. Some had capabilities for looking at new biocidal kind of solutions. But oftentimes when folks have new approaches, sometimes it's not actually beyond basic research oftentimes. And so actually kind of harvesting the best that the nation has, new capabilities, and kind of figuring out and forgive me for saying it this way, but the muck in the mire, what's something that we can actually use versus things that are actually need to go further back into the developmental cycle. So as we collected and tested personal protective equipment for healthcare workers and soldiers to answer some of these technical questions, a lot of our staff were brought in specifically to look at some of the work to support the nation's healthcare, keep our soldiers safe, as well as some of our civil support teams and folks that protect the nation from the first responder capabilities. So we established or supported partnerships. So partnerships are critical to addressing some of these challenges. So it was everything. Next slide. Go one more, please. Okay, so we looked at a lot of it was respiratory protection, everything from N95 respirators, barrier face coverings, filtration media. And we often had some new filtration media that had some novel capabilities that we were looking at. Some things that were more in the developmental basic research fronts, but some of that we were able to advance much faster. We looked at a lot of novel personal protection solutions using 3D printing. So we have a huge additive manufacturing center, and it actually came to bear for COVID, working with the United States Army Medical Research Institute of Infectious Diseases. We did a lot of work actually to support the Army at large. And actually, when you think about Operation Warp Speed, prior to moving into Army Futures Command, we were part of the Army Materials Command. So General Perna, as he led those efforts, knew a lot of the capabilities and that we possessed for additive manufacturing. So some of the novel testing solutions actually used some of the 3D printing capabilities that we had. And then we did a lot in terms of looking at some detection capabilities, diagnostics, and decontamination. So for example, one of the things that we really highlighted and were brought to bear quickly, we did a lot of work with DHS as well as In-Q-Tel and others to provide mobile medical laboratories to go to the Javits Convention Center and provide medical mobile laboratory capabilities. And some of that actually, we actually had to have some of our folks use 3D printing capabilities to re-engineer some of the BioFire film arrays together in some of the vehicles that went up to support some of the National Guardsmen. We had a negatively pressurized Connex, and this was a novel approach for supporting the Air Force. And this negatively pressurized Connex, and there may be a picture in Let's go to the next slide. I think you'll see a photo of that. You can see the negatively pressurized Connex Lite. So there's two versions of it, but the NPC is actually a 40-foot metal shipping container outfitted for medical care and transport of infectious patients aboard a C-17 transport jet. The Lite is actually, so normally this would transport aeromedical evacuation of up to 30 COVID patients, including accommodation for litter and critical care patients. But we actually looked at a Lite system. So one has to uses a C-130 and another one a C-17. So the Lite actually allows transport of about 20 patients. The other side of it is we actually used this capability back in June for CENTCOM to actually evacuate 12 COVID patients using these capabilities, and that has expanded as a capability for the future. Along these lines, we looked at surface decontamination methods. We actually use canines for detections. We have a program that looks at olfactory sciences, and we're using kind of what nature has developed in terms of the dogs. And we've actually used that to look for biomarkers and finding pre-symptomatic exposure kinds of biomarkers. But as we were doing some of this research, we actually found out that the canines are outstanding for pre-symptomatic identification of folks who are positive for COVID that you won't necessarily see in an early COVID test. And also applying expertise to areas such as supply chain management. So, you know, as the nation got hit with a lot of these small businesses that closed, in the case of Chem Biodefense, a lot of the carbon filtration companies are actually local to this area or to Pennsylvania, and they're small companies. And without maintaining the industrial base, we would have irreparable damage to our ability to provide carbon filtration media. So we actually had to do some work to ensure that these folks were able to still operate and to maintain that industrial base. And we utilized several mechanisms for interaction, and these were both formal and informal. So when you look at a formal process, obviously service agreements like memorandums of understanding, memorandums of agreement, material transfer agreements, cooperative research and development agreements, as well as technical service agreements. But beyond that, we had a number of informal approaches to actually getting work done. When I was having conversations with In-Q-Tel and Dr. Tara O'Toole and others, we were actually on the phone with governors of states and whatnot till, you know, the wee hours of the morning, wee hours at night. Oftentimes, it's hard to say which was which, but the time was running into each other. But we actually came together and established those networks and communities of practice that allowed us to be responsive in a timely fashion. So when I think about the lessons learned, a chemical and biological organization such as ours, we have a lot of expertise that's very relevant to biological incidents such as COVID, but also bridging the gap between emerging biological pandemics, emerging threats from a medical perspective, but also what we do in our core mission, and that's looking at biological threat agents. There's a lot of synergy that we could leverage and utilize. One unforeseen event in general is not, there are a number of partners involved. So historically, of course, Health and Human Services has the authority and the responsibility to lead the nation in a number of these events, but we're all at the table together. And we have the expertise and facilities to contribute to developing technologies. One area that I found is that oftentimes folks that don't necessarily have the expertise or the facilities, but they own the mission, own the money, the funding, that oftentimes puts us in weird situations where we don't always bring the right team of experts. I think we've gotten better through this, but some of the, I talked about things that have atrophied. I mean, there were a number of meetings, for instance, historically with the FEMC, the Public Health Emergency Medical Countermeasures Enterprise, that once existed. They still exist, but I think some of the membership has turned over. We've, especially as COVID has transpired, you have a number of folks who have just lost the touch points of working together. I do think that technology has facilitated the way we're meeting right now, for instance. One of the challenges I noticed is that we're all on different systems. So oftentimes it's hard for us to communicate across the board. The Department of Defense mostly is using MS Teams. Some defense agencies are using Zoom for defense. Others are using Zoom more for commercial entities. And so, as well as other sorts of platforms. So I think one of the most important things we have to remember is in order to understand the problem, we have to understand the fundamental principles involved, the science. I always say to our team, lead with science and identify where we have gaps in addressing the problems, identifying the right partners in the interagency and across other disciplines. I think that multidisciplinary approach, when we started forming the teams over time, really brought a lot of fruit to bear for us. It helped us fill in the gaps, whether it was for facilities, talent, expertise, or expanding our networks. The communication of factual information. We noted that it needed to happen between the partners and teams and their external community frequently. So we saw that rapid response is crucial. There is a need to quickly identify gaps and establish partnerships with relevant entities. In addition to these relevant entities, we also saw that we quickly learned the power of collaboration across government agencies, industry, and international partners. And while it's unique, it satisfies experiences on all calls, whether it's from the Office of the Secretary of Defense, NIH, services, National Guard Bureau, working together for a common purpose. We've done a lot of work by actually matrixing folks to help support Health and Human Services as partners for Operation Warp Speed. We actually ultimately became the DoD contracting arm for the vaccination effort. So this was a large collaboration and was indicative of the power of coming together. I think our personnel supported our Joint Program Executive Office for Chem Bio Rad Nuke Defense. And we matrix personnel who actually went to support the vaccination efforts. Maintaining critical plans and infrastructure. So just not a lot of science fiction anymore. The threats are real. We need to stay ahead of them by committing funding, not waiting until the worst happens. And I think we've got to look, expand. So I'll give you an example. So years ago, I was briefing the Defense Science Board, and they looked at some of the research that we were doing, and they felt like we were talking about not being perceived as having an offensive program and the compliance review group. And they said, look, you all are putting the nation at risk because you're being so conservative with what you're defining as an offensive program. So historically in our space for offensive bio program, you'd have to look at disseminating bio threats. You'd have to look at weaponization and other sorts of things, not necessarily going into the laboratory and doing some work for a vetted compound or in the chemical world, for instance, we'd look at new chemical moieties where you had a functional group that changed. Well, the same correlate of that for biology, not necessarily going and synthesizing new threats, but looking at not being so conservative that you put the nation at risk. Factual, frequent communication being critical. Empowering the general public and the experts actively working on technologies to have situational awareness and an enhanced understanding of the challenge. And so when we looked at our COVID-19 response, it demonstrated the power of misinformation. Many of our experts were answering questions that were the result of misinformation, while others were trying to complete technical work in an environment that had sparse equipment and resources available. When this first started, I had a number of folks over in Australia who were there doing some demilitarization work from old stores of munitions that had been there, left by the US from World War II. And as our folks were doing this work, oftentimes, they wound up being quarantined, trapped up, I shouldn't say trapped, but stuck over there without all of their infrastructure that they would need when they would be coming back and forth and having a new team refresh them. And we were overwhelmed with disinformation and many so-called experts fielding and responding to various queries in the midst of the supply chain challenges. So I think we saw that inherent throughout, where you had a lot of folks who weren't necessarily as much of the subject matter experts that they were purporting to be. And so we had 40% of our time spent on answering questions that were rooted in misinformation. So a lot of our subject matter experts had a lot of their time that was wasted just responding to high-level officials and corporate CEOs who were just pushing technologies that weren't often of value to us at that time. It spurred renewed interest in mitigation strategies. And I think that was a good piece. So in one case, we had a number of folks come together and look at some novel approaches to what we were doing. We also learned about new strategies for looking at threats. It's always a question and a challenge for us to understand what's, as we should say, what's live and what's Memorex in terms of threats. But simple things like maintaining clean and hygienic practices, air handling, mitigating and restoring laboratory operations. Biosurveillance is a critical capability. Renewed interest in population health assessments and just public health in general. And for us, we've developed some novel approaches to interrogating bio and chemical clouds from a battlefield scenario. But some of those technologies where you have sensors that are on drones and other sorts of technologies could have application here. And so these hurdles to overcome are beyond our control in the crisis, but partnering with the right people and innovating helps achieve resolutions. And so cutting through some of the bureaucracy and the red tape, some of the supply chain limitations, we found some ways to circumvent some of these challenges. I think I'm pretty much finished. Let me see if there's anything here I wanted to highlight that I didn't. And so we continue to partner. I'll just kind of end with looking at this. That's some CARES Act funding that did that, but that's some innovative work that was done here in the center to actually do organs on a chip. And that's a lung on a chip model that actually binds the coronavirus, SARS-CoV-2. And actually, we can actually do some studies that actually look at some of the mechanisms in lung tissue. So there's a lot that's going on. This has been leveraged and worked throughout the community, obviously for things like pharmaceutical development, but also for detection and just understanding the response. And with that, that's all I have right now. Thank you.
Thank you very much, Dr. Moore, for this incredible, comprehensive, I think, insights. Obviously, we would have questions for you later on related to your experience, which is very broad, connecting the military and the civilian, the academic, scientific community, and so on, and the general public as well. So we'll come back to you again in the interest of time, if I may. I would like to move on to our next speaker all the way from Madrid. And we would like to introduce Professor Natividad Carpintero Santa Maria, who is professor of Polytechnic University in Madrid and General Secretary of the Institute de Fusion Nuclear in memory of Professor General Velarde. She obviously spent many years dealing with some of the multilateral issues that we discussed today, all the way from organized crime and security to energy security, and dealing also with some of the issues related to the nuclear threat, the weapons of mass destruction. So we asked her to prepare also a PowerPoint presentation and to highlight some of her concerns of the nature and intensity of the threat and what can be done to reduce the risk. Nati, please.
Thank you very much. First of all, Professor Alexander. Good night, good evening from Madrid. Again, thank you very much, Professor Alexander, dear Jonas, for this invitation. And I would like to greet especially to General Gray, because I think that he's there. So General, my General, good evening from Madrid. I had the pleasure to meeting you in your institute in Washington in 2015. So I'm very, very happy to see you here. Well, as Professor Alexander said, my presentation, next slide, please. Is dealing with technologies that are being developed after, especially after the COVID pandemics. The introduction is that it's true that the COVID-19 has brought significant socioeconomic changes in our lives and an unexpected acceleration in the digital technologies. These technologies has been, during the pandemic time, during our confinement at homes, very important for our lives, business, education, during this period. And we're going to deal directly now with the problem of the issue, not the problem. It depends on how we see it. Artificial intelligence that was born, and all of you, as all of you know, in the 20th century at the beginning, and is becoming one of the most powerful tools for high intellectual processes through complex and neural networks. Next slide, please. If we have to talk about developments in present and future and next and medium and long-term future, we have to focus on these five issues. The main one, naturally, artificial intelligence. Everything is over this core. We've got to think about the Internet of Things, but I go clockwise. Virtual reality, augmented reality, the issue of blockchain that has been explained very well by our colleagues just now, the issues of voice use interface, the VUI, which is allows, as you know, us to interact with systems through voice of speech commands. We've got the cloud, and we've got one of the most important items for us is cybersecurity, to deal properly and positively and the best as we could with all these complex neuronal systems of the website. Please, next slide. Emerging technologies and COVID-19 crimes. Well, as all of us know, that technologies advance our work for the welfare of people, of welfare of mankind, but sometimes we have to face, very importantly, the negative aspect of development of technology. So during the pandemics, there were a lot of people that, receive thousands of fakes news, of fakes announcements of medicaments, of medicines. So we have to be very careful with this. During the coronavirus, for example, with the European Agency for Health, and even this picture on my right hand explains about how to deal with these shoppings of fake things, especially medicines. Many people thought that people were sending in the web the solution for the illness, for the virus, and was not at all. The next slide, please, tells us how Interpol were constantly telling us the dangers of this situation, because especially and during the pandemics, fraud and phishing and hacking attempts were increased very much in a high percentage of cases. Okay, so Interpol make constantly the reports telling what was happening about the fraud line of telephone, medical supplies and medicine, the counterfeiting, making fakes of these medicines, or phishing requests for login details or click on links in order to keep information of the persons, or hacking attempts as well for gaining personal information. That has been intensely used during the pandemic period. Please, next slide. So how can we focus the problem? Let's see the issue of emerging technologies and the threat of weapons of mass destruction terrorism. First of all of us know, and has been always in the history of mankind, that advances have been used for good things and for malicious ends as well. And it is especially worrying when we see that the use of these technologies can be in the hands of terrorists, can be in the hands of non-state authors, can be in the hands of people trying to use them maliciously. So there are different emerging technologies as we have seen so far, but I would like to emphasize, just because we don't have much time, to focus the attention in unmanned aircraft systems or drones, in big data analytics, blockchain, additive manufacturing, and three-dimensional printers, and cyber attack. I will go very fast on this, so can you please, if you can, or yeah, okay. Blockchains and cryptocurrency has been very well explained by our colleagues before of Georgetown University. They store data in blocks, that for this reason they are called blockchains. They link the block to each other, and in chronological order. It's very much used, as you have said before, in transaction, in money use, in money transfers, in bitcoins, etc. What is the negative side of blockchains? What is the negative aspect? The fact that they can be used to sell and to buy items, dual use items, okay? Because we know that weapons of mass destruction is a dual use technology. Therefore, it implies dual use technology. So that the use of crypto, of blockchain can imply that terrorists or can buy this kind of materials online. Positive, well, because we can improve with blockchain nuclear safeguards information management. As you said before, it involves a trusted report. Therefore, in this sense, all the information that is there is we cannot delete it. Therefore, for keeping care, for improving nuclear safeguards is useful. Okay, it improves confidentiality. Yes. Next slide. Additive manufacturing and three-dimensional printer. Well, of course, naturally, if we want to make a malicious act of involving weapons of mass destruction, we are dealing in the illegality. We are going to use illegal manufacture of equipment, and this can be done presently with this 3Ds. We can talk about, you have talked a lot before and very well, starting from Rita to the rest of our colleagues, of the using biotechnology, right? So this is everything said and very interesting, your presentation. We can use 3D analytic manufacturing to counterfeit goods and naturally to steal intellectual property. We can produce explosives. If it's possible to produce 3D carbon fiber composites, we can do another explosive or explosive containing this formula. And finally, it's possible with 3D printing to introduce design flows in critical components of military delivery systems, which will be possible as well. Rockets used to deliver nuclear warheads and so on. Please, next slide. Drones. Of course, drones, as everything, has double use, or not double use, excuse me, two faces, the positive face and the negative face. And all of us know, in the first case, we can use unmanned aircraft systems to release the CBRN materials. For example, during a major event, we have already cases that have been registered. Okay, we know that they have been used in that sense, especially in football, in soccer, good events, big events. We can use to attack a power plant, a chemical power plant, or sabotage it. And they can be used as well to swarms to carry CBRN materials. Okay, it's possible, especially when we have a lot of drones together. It's really incredible to see the groups of drones together and how they can actually have an incredible force, an incredible power. Positive sides, of course, they can help us to detect CBRN materials. They can help us in forensics. I can take to get samples and the characterization to get samples for later characterization of this sample can be done now with drones. And naturally, in the positive side, we can use drones to support units in counterterrorism operations. So all of them are empiric facts. In the case of the use of released CBRN materials during major events, are empiric facts so far, and we have to take all these kinds of precautions and know what is around us. Next slide, please. Cyber attacks are just to focus a little bit on nuclear power plants, because it has not been mentioned yet, and it's my paper main. Nuclear power plants are having a transition of analog systems, which have got obsolescence, to digital systems. So this is a challenge. This is a challenge because when we talk of defense on that system to protect nuclear power plants. And therefore, in this case, we have to take into consideration that all the control security systems and facility networking security systems are being upgraded presently. For this reason, we have to take into account these threats, these new vectors, these new threat vectors that didn't exist before, because nuclear power plants, they have been very conservative in that sense to avoid the cyber attack or cyber problems. Presently, there are several centers working in this, and I'd like to emphasize the work of Sandia National Laboratories in Mexico that are developing the integrated cyber physical impact analysis, as well as the Center in Maryland for International Security Studies, just to distinguish what is a cyber attack that can be a personal consequence or a public concern, a health public concern consequence. So we go again, the next. Insider threat, I always insist on this. Every time I have to give a presentation, I have to insist in the problem of insider. Insider has been remarked. They have been always the problem when malicious acts have been done. Many times when insiders involved. In this case, in the nuclear threat, the International Atomic Energy Agency insisted that the problem of threats, inside threats, is a unique challenge to the establishment of effective control of nuclear material. Because they have access, together with their authority or knowledge, a big opportunity to bypass dedicated physical protection elements or other provisions, such as the safety systems and operating procedures. In the next slide, we can see the circumstances, of course. We have always a profile of this other threat, a person that implies dissatisfaction or resentfulness or corruption, or due to sentimental or ideological affinities, or for economic gains. That leads to the vulnerabilities that these persons can create. new media platforms that we have seen, anonymity online, smartphones and tablets, which everybody has got, is another step to take into consideration when talking of insider threats that could lead naturally to dissemination of sensitive information and high-level data breaches. So in the next slide, I think that, yeah, we can see the protective measures against insider threats. Firstly, a preventive and protective measure against insider threats issued and published by the International Atomic Energy Agency, which is especially focused on the nuclear field, on the nuclear power plant for civil purposes. The International Atomic Energy Agency works with countries developing nuclear energy for civil purposes, absolutely. Afterwards, in the United States, several best practices books has been issued, as the ones you have seen in your screens, Insider Program, Maturity Framework, or Protect Your Organization from the inside out. Presently, in some countries, they fear more to the insider threat than to the outsider threat. Please, next slide, and some conclusion to finish my presentation. A reflection on the tertiary effects of technology. What are the tertiary effects of technology? As all of you know, that effects that are beyond our will, that are beyond our hands. We can be victims ourselves of these these emerging technologies that we don't know exactly where we'll go, and we can be victims directly. These are the tertiary effects. We have to be careful until what point can we get or we cannot. Technology can alter the tactics of terrorists, of course. We have seen conventional tactics, and it's true that terrorists continue using simple tactics. But this simplicity should be linked presently to these developments of these technologies that we have seen so far, and some of them that we haven't had time to see. Technology, in any case, cannot replace totally the human role in the prevention of combating weapons of mass destruction, terrorism. And my favorite sentence is that the weakest factor in the security chain is the human factor. The more the weakness, the deeper weakness in the security chain is always and will be the human factor. And the last is to tell you that indeed the threat, I insist, that the threat of insiders becomes very relevant. For this reason, it is necessary to develop visible security policy on human behaviors. Visible security policy of human behavior. That includes motivation of the people that is working, vigilance, effective communication among individuals, teamwork, and cooperation. Professor Alexander and all colleagues, this is my presentation. I think I have finished. I don't know the next one. It's just thank you. Okay, so thank you very much, and a pleasure to be here again. Thank you very much again, Professor Alexander, for your invitation. Thank you.
Thank you very much, Nati, again, for your very comprehensive presentation, also putting some emphasis on the human role element in terms of threats and responses. Again, we'll come back to some of the points that you mentioned. I would like to move on to our last speaker, colleague, Ambassador Charles Ray, with whom we worked for quite a number of years, also through the American Academy of Diplomacy. I just want to mention that he has very rich experience as a diplomat, ambassador, also serving in Asia and Africa. But I want to also mention his service as Deputy Assistant Secretary of Defense for POW, Missing Personnel Affairs, that he worked on for quite a long time, and also to thank him for his service in the military of the United States Army, in his work in Europe and elsewhere, and also a number of tours in Vietnam. So, Charlie, perhaps you can make some remarks at this point, and then we'll open it up for Q&A of the contributors. Charlie?
Thank you, Yona, and thank you for including me. As always, I am in awe at being included on a panel of such distinguished experts in their field. They have given us today some very interesting and informative presentations. I'd like to mention briefly one issue that's been lightly touched on today, but that I think is very important, and that is closing the technology gaps that limit our ability to respond effectively to crises such as the COVID-19 pandemic or climate change or any other mass disaster. And I use the plural gaps deliberately because in my study, I have seen two that I think are very important. One is the gap between the wealthy countries and the poorer countries in access to technology that can be used to deal with epidemics such as the COVID-19 pandemic. And while it's been mentioned that things are being done, I think it was also mentioned that it's just a drop in the bucket. There's much more that needs to be done, that should be done if we have the political will to do it. But the second gap is one that really troubles me, and that is the gap between the rapid, almost light speed advances of technology that we've seen in our lifetimes and the snail's pace at which the human mind is able to understand, accept, and effectively use that technology. And unfortunately, that gap is, in my observations over the last 18 months of this pandemic, almost more prevalent in the so-called developed world than it is in some of what we call a developing world. I think we've all seen it, the refusal of people to wear masks or social distance because they thought the COVID was a fake, a hoax, viral outbreak, that it really didn't exist, or the refusal to be vaccinated because of the rapid speed at which the vaccines were developed. My own experience when I got my COVID shots at the Naval, the National Institute of Military Medicine at Walter Reed, the young military corps person, the medical person who checked me in to get my shots, informed me quite blithely she wasn't taking it because she didn't trust it. It was developed too fast. Until we address, I think, we close this gap, this lag between the development of technology and the human mind's acceptance of that technology, I think we'll forever be constrained in how we effectively deal with outbreaks like this. It's clear that we don't learn from history very well. If you study the 1918 influenza pandemic, you'll find that you could block the screen and listen to some of the protests that existed back then, and you would think you were listening to the protests that we've been listening to for the last 18 months. You didn't have the anti-vaxxers in 1918 because you didn't have a flu vaccine, but I suspect that had the flu vaccine been invented in 1917, there would have been people in 1918 who would have refused to take it. And with that, I think, I would say too that the other thing that distresses me about this technology gap, this lag between development and acceptance, are the number of people who you would expect to know better, politicians and media organizations who feed this ignorance, this lack of understanding of technology, and it would be easy to say that such people are just ill-informed and ignorant if it weren't so frightening, and if it wasn't really a matter of human survival that's at stake. There's a saying that ignorance is bliss, but in this case, when a viral disease can start in a remote area of the world and be global in a matter of days, ignorance is deadly. And with that, I will stop talking and give it back to you, Yona.
Thank you very much, Ambassador. What I would like to do, we don't have much time, but if I may, as moderator, ask the presenters, the contributors to our discussion, perhaps if they wish to make a comment or to ask a question, their colleagues. And I think this would be a opportunity now, because again, the clock is ticking, and soon we would have to end this most interesting dialogue. So I guess we have to begin with, I don't know if Jen is still there, or if not, Rita.
Jen had to leave, so.
I'm going to have to jump off myself. It's been a hugely interesting session. I've really enjoyed it immensely, and I thank you all, especially Don Milton, whom I know is barraged with requests to speak. And so I just want to thank you all for participating and for allowing me to participate as well. So I think I'll pass on the questions, Yona.
Thank you very much, Rita. So we'll move on and ask Dan. Are you still there? Dan, you're still.
Well, I thought this was a very productive session. I enjoyed hearing both the more general presentations, but also some of the specific ones. It's very interesting about the aerobiology and what we got right and what we got wrong with respect to, the guidance, the public policy guidance that came out, and how that was really problematic in terms of some of the actions. And I think, that difficulty in being able to be giving proper guidance complicates when you then have to tell the public, well, what we said before was wrong. And so I think we've got a lot of work to do with strategic communications. And I'd be interested to hear if anybody else sees that same issue.
I certainly am aware of that issue, and I talk a lot. We have a professor here who used to be at CDC and whose focus is on communications, crisis communications, and she would argue that CDC was not following the playbook that she helped write 20 years ago when she was there. And one of the key things is that you need to be very upfront about it. This is new. We don't know much about it yet. And what we're telling you is the best we've got. We'll tell you more as we learn more. And that's got to be upfront in the message all the time so that people have a sense that you are sharing what you know. Now, I guess there's some question when Trump's telling Bob Woodward that he knew that it was airborne and he wasn't telling anybody whether that was happening. But that is really crucial. And in the current environment and the level of distrust that Ambassador Ray was referring to, this just abets the whole situation. And then when you have, groups of outside scientists saying, hey guys, we know something and it's not being paid attention to, I felt very conflicted between trying to get the message out of what I knew was going on, because I could see it right away looking at the CT scans coming from Wuhan in January, and knowing what I know about pulmonary physiology and the physiology of infectious aerosol generation, it was clear to me in mid-January that this was likely to be airborne. And yet I didn't want to undermine faith in the CDC. We need the CDC to be right, but even more, we need it to be strong and people to listen to it. So it's a terrible conflicting situation that many of us have been in this year. And that's that's the point of my talk is, how do we, some of it is the medical profession was very resistant, as, Ambassador Ray was talking about the public, but the medical profession, my classmates from Johns Hopkins, one of whom's in Congress, I don't agree with anything he does, but that's another thing, is, been terribly resistant.
Okay, thank you very much.
Let me just add, I'm sorry, this is Neil Wasserman. I'm inspired by that comment, and I think one of the lessons learned is perhaps to lower the risk of being uncertain. That the CDC, is a premier organization, and I think we'll learn how to make it better, how to insulate it from political risk. That is, putting the data forward should not be a political risk. It should be something that's encouraged, and applauded. The other issue that I'd like to highlight is, how do we set up a regime in which strategic decisions are made based upon the best information? That is, how do we make the threats that are actually important visible and actionable? And I think we'll learn a lot from the COVID experience in that area. And how do we translate that, when necessary, into social behaviors that need to be adopted and practice that is spread on a population-wide basis? I mean, that's a big challenge to learn how to do that better.
Thank you very much for your comment. Perhaps we can ask Dr. Eric Moore. Would you like to make a comment or ask a question?
Yes, I know it's getting late, but you fine gentlemen and fine panel members have really, I had several questions I wanted to throw to the group and comments. Bottom line is, I would just say I agree wholeheartedly with what I'm hearing here. So I don't want to be redundant in that regard. One of the areas that I would just kind of ask, so when we talk about strategic communications and getting the right kind of information out, and this is for the other panel members perhaps, have we learned enough from the 2016 election? So has anyone tracked kind of the social media implications, where there's social media misinformation campaigns that went on that also impacted our response to COVID? So I think we learned a lot from the 2016 election, but when we look at our response as a nation, what if there was a concerted effort by some of our adversaries to discredit some of the momentum, to create disbelief in our systems and the communications coming from our healthcare profession? So just a thought, just a question out.
Mm-hmm. Anyone would like to respond to that?
It is true that we had a problem with our adversaries attempting to undermine faith in our political system, in our system writ large, and that's bad. But we also had, and as our distinguished Spanish colleague said, the insider threat. We had people who were part of the system who in many cases were deliberately attempting to undermine faith in the system for political advantage. And, I don't think that there is an instant solution to this. It's a matter of looking at how we educate people to think and evaluate the information they get. If we're going to remain a democracy with freedom of expression, we instead of blocking this, we need to equip people to do their own evaluation and look at it carefully. And unfortunately, I don't see a short-term answer to that, because we've almost irrevocably, in terms of the adult generations in this country, divided into two herds, with one herd milling around in a circle and the other herd heading for a cliff.
I'd like to also build on that if I can. There are two things going on here. One is the recognized gap between what science can do and what policy and law is understanding and can empower science to do. That's number one, and that's been the case for many, many decades, that science and technology runs ahead, and then laws have to catch up, and the ways the governments react to laws have to catch up. The second thing is the function of communication. In work that I'm trying to help the United Nations system, we are emphasizing the role of the communications function between science and policy. How do you engage the scientists, but also people other than the scientists? We have to become a little bit more generous and get in the voices of others, whether it is people who are in government, people who are at the neighborhood level or individual household level. We have to engage in a debate, because there is no longer an absolute truth to anything. We have to be able to listen to each other and then shape communication messages that are in fact representative of a variety of views. It is not to say that science doesn't have the best view, but it is still a view. So I'd like to beg my colleagues on the science side to understand that listening to those who are impacted by what we know is vital to our ability to convince them of our truth.
Thank you very much for your comments. Anyone else at this time? Well, obviously we covered the territory for, I think, the next forum dealing with the role of communications, the role maybe of intelligence. Again, as an educator, I'm concerned about the next generation of students and scientists and policymakers and so forth, and now to invest in their future as well. I think that we have to end, unfortunately, at this point. I know that we have some distinguished members of the audience, and if they would kindly consider sending us their questions, and perhaps we can continue the dialogue this way. I would like to thank again on behalf of our colleagues at the Potomac and partners, to the presenters, contributors, for their very rich, I think, insights. And I want to thank you again for your time and for the service, and we'll be in touch with you with the hope that we can, however modestly, advance, I think, our work in this very important area. Coming back to what Charlie said about history, I think some of the wise observers for many decades warned us that we learn from history that we don't learn from history. So I think we have a big mission now to make sure that we can somehow work on restoring the trust of the people in the government and the role of science and technology. So again, thank you very much for your contribution and have a good evening. Thank you. We're going to close the session now.
Thank you as well.
Thank you very much.
Thank you, and very nice meeting all of you.
It's a pleasure, pleasure indeed.
Pleasure.
Thank you very much.